Well, I'm excited. I was a bit shocked for sure that I actually won the award because I just feel like there's a lot of people out there, a lot of pharmacists out there that's doing the same thing that I do. I would say my heartbreaking moment that sort of leads me to committing myself doing all these work is the moment when I was doing a private clinic. And they have been doing this private flu clinic for every single year. But this one year, and I remember so clearly, 2013, she picked up the phone, PAing the entire company, said, "Oh, the nurses are here!" Everybody got so thrilled. Everybody comes in and tell me, I haven't seen a male nurse doing injections for so long. And I'm like, I'm not a nurse, I'm a pharmacist. And that's the moment where I decided, you know what, I think I should do a little bit more and let these people know what pharmacists really do.
Well, I think it goes without saying, David has really built a reputation for our pharmacy and our pharmacists to be clinical skill leaders in the community. Our patients know us for this, they refer their friends and family to us for this, and it's because we're really adding value to our service. I think we're really about educating our patients and really pushing for preventative medicine. So really in that case, it's about educating our patients. The more they know, the more they're better able to make informed decisions about their health.
To put it in one sentence, we are the drug experts, and that's the message that I want to convey to the patients, the customers, and also to the doctors and all the other healthcare professionals. If you have any questions about drugs, you come to us.
You know, the David that I have come to know is extremely intelligent pharmacist. He thinks, I believe, outside the box. He seems to be able to understand the depth of a relationship between a pharmacist and a medical doctor's office, as well as the doctors themselves.
A lot of times it's not just only verbally telling them, and also to show them what we really do and to really demonstrate we have the clinical expertise. I've been asking them to really convey that message. We're not there just to tell them one tablet twice daily. You know, we can write a label, we can get a robot to do that. We're there to tell them, is it really necessary for them to take this medication? Is this medication going to be effective for it? Are they going to be compliant? How are we going to be making sure that the patient is compliant to the medication, right? So those are the things that we, or I, of course, is trying to make sure that the pharmacists that I work with do the same thing as I do, is really convey that message to the patient.
It's very unusual to actually find that gem or that pearl of an individual that sort of stands out.
So I love talking to people, letting them understand my point and letting them understand what I do. Whether it's immunization, whether it's medication review, whether it's adaptations, I let them understand the reason I do it for them, and it is for them. I think the unique thing that I kept on telling my team and telling the doctors next door and you know, the local health unit is about what we do and how we are doing something that's different from what they are doing for the same patient. It is very, very important that we're focusing on the patient, so it's the patient-centric care, right? Everybody is a team. You take care of the diagnosis, I'll take care of the drug part. What I don't want to do with the doctors that I've talked to is, you know, I talked to you for half an hour, you didn't get anything, right? I will spend 2 to 3 minutes talking to you about one thing. Next day, I'll spend 2 to 3 minutes talking to you about the same thing again. You know, at the end of the day, you know, the Dr. Abelman one day will be like, I get it, David. I know what you're saying. You know, we'll work it out. You know, and that's how you try to, you know, relay one message at a time. And if the first one succeeds, we move on to the second message. And that's how I sort of move forward with a healthcare professional. Same thing with the local healthcare unit as well.
There was a fair measure of pride. Like, I felt very proud that he won it. He deserves it, absolutely. He's done a lot for this store and for the community.